Hello, hello, hello. I'm Chelsey.
And I'm Sammy, and this is Deepish.
Hi, you guys.
Hi, guys. We have Adria Young on the podcast today. She's a nurse practitioner. That is literally going to change your life. She just changed ours.
Oh, yeah. She's a functional medicine NP. So it's more of a holistic approach and Western medicine combined. So she looks at the whole of your body and how can we heal this within versus, okay, I'm just going to throw a medication at you. She does your whole panel and every little detail of every part of your body.
It's the perfect combination because she takes so much time with her patients, takes the blood work that the regular doctors don't think to take, and really finds out what's going on with your body, your hormones, autoimmune, PCOS, all of these different things that feel so hard to grab a hold of.
We talked to her for so long because we were like, wait, what about Hashimoto's? What about Tirzepatide? What about ozone therapy? She talked on all of these very trendy topics and then also the benefits behind a lot of those.
And was able to truly educate us on the thyroid, women's hormones, and pregnancy, PCOS. I know so many of you guys struggle with these things. We selfishly were excited to have her on so we could ask her all of these questions, but I think they're genuinely questions that you guys probably have too.
And also we just learned about her as a person, how she got into the medical field, her upbringing, her background. That was super interesting. She has a really cool story.
Yeah, I'm so envious of her doing something that she's so passionate about and loves so much, just helping people change their lives through their health. And she's so good at it. She knows her stuff and truly cares about her patients, which is really cool to see.
And she also did IVF, so that was cool to hear her experience with that, working in the functional medicine world, what she would have done differently, knowing what she knows now, going through infertility.
We think you guys are really going to enjoy this episode, and here is Adria. Okay, you guys, this episode is sponsored by Minky Couture, which honestly is my dream sponsor. Something about a Hugs Minky blanket fresh out of the package. I feel like I need one for every special occasion. I'm like, okay, the seasons are changing. Let me get a fresh Minky because they make life that much better. So I've been thinking I want to get one for my IVF journey just to be with me through my whole egg retrieval and the transfer and have something to snuggle up. I got my very first Minky blanket when my mom passed away. My friend gifted me that. And now it's my go-to gift for somebody who's lost someone or is going through something, because wrapping that, it literally is a comfort warming hug.
Yes, exactly. My first experience with Minky was when Lennox, he's 7 now, he was in the NICU, and they gave him to all the parents in the NICU a small infant blanket.
They did?
Yes. And I remember just wrapping Lennox in that and cuddling with him skin to skin and then putting the Minky over, and it meant so much to me. It was such a thoughtful little gesture. I've had all my babies wrapped in it, and I just fell in love with the company then, and now my house is covered in Minky blankets. My boys on their beds, when we're cuddling on the couch watching a movie. It's weird how it's becoming part of our story a little bit.
Totally.
And they have so many different sizes, textures, patterns. You will 100% find the one that matches your aesthetic, what texture you like, everything. And some are a little more weighted, like the Hugs version. It's so good. If you want to experience it yourself, head over to minkycouture.com and use code Deepish for 50% off.
50% off. It's amazing.
Yes. Get cozy, stay soft, and hold on to those blankets while they become part of your story.
I know. I'm excited. I'm just going to pretend I'm not being recorded and we're just having a conversation.
Well, I feel like your story is so interesting too, just your personal story. So I feel like that'll be really cool to like get into it.
How do you know her? Did you just find her on social media?
Yes. Okay. So I was like, Fix My Life someone on TikTok. And then I came across your low dose naltrexone video. Called my doctor. Yo, I need this to fix my life. And so I'm actually on it. I'm 1 week in.
Oh my gosh. How is it going?
No difference.
You're probably just on a super low dose at the moment.
Yeah. So they start me out at 1 and then I'll go to 2, 3, and then we'll see how I'm on 3 and then maybe go to 4. Do you feel like I'll see any difference?
What symptom relief are you looking for?
I've been feeling really anxious lately and no energy.
Okay.
And so I was like, hopefully it'll help with energy and calming my nerves a little bit. And then hopefully some inflammation and hormone support.
Inflammation's probably the number reason I put him on low dose naltrexone, but I'm personally on it for the mood support. So I was able to come off my bupropion that I was on for some anxiety, but I'm also on progesterone as well. So I almost wonder if you need some progesterone.
I'm taking the synthetic progesterone because of you as well.
Okay.
Because I go to a functional medicine doctor because I've been having periods every 2 weeks.
Oh yeah.
So she's like, let's do this. And I was like, no, I don't want to do progesterone because I had to do progesterone progesterone shots while I was pregnant and it was a nightmare. And she's like, no, synthetic is totally different. And then I watched her video and I felt so much better because you explained it so well.
I think that's where it gets confusing. It's an umbrella term. So patients are like progesterone and they think it's all the same. But there's tons of different types of progesterone, which in birth control, you have more of the synthetic stuff. And then bioidentical progesterone mimics your body's natural. So patients usually have less side effects. Every once in a while, I'll get a patient that maybe doesn't tolerate it well. And then it's like, okay, let's try something else. But I would say for most patients, they tolerate it really well.
I know. I'm like, wait, be my doctor. I personally have received from your videos a ton of knowledge. And so I was like, I need everyone to know this stuff. Because I don't even think my doctor would have recommended LDN because she's like, usually I give it to my autoimmune patients and you don't have an autoimmune condition. They thought maybe I had Hashimoto's and I was like, well, what about this? This is what I'm wanting support on. And they were like, it's not harmful in any way.
Exactly.
Let's try it and see.
Yeah.
Well, anyways, that was a little side note. Adria, welcome to Deepish.
Thank you.
How are you feeling?
I'm feeling good. A little nervous because this is definitely out of my comfort zone.
I know.
Have you ever been on a podcast before?
Never. I think it's definitely good, though. I told my husband, if anything, it's good to do things that push you out of your comfort zone.
Totally. And I feel like you just have so much wisdom.
So lucky to have you here right now.
Oh, you guys are so sweet. Well, I'm excited to be here.
I want to go back to the beginning, learn a little bit about you. Where are you from?
So I guess from a couple different places. I was born in Logan. I was raised there in a little town called Smithfield, very small town. So I grew up there till I was about 10. And then my parents moved to Kaysville, Davis County area. So then I mostly grew up there. I went to Davis High School. And then for college, I played college volleyball for a couple of years over at Slick. So I lived in Salt Lake for a couple of years. And then I went up to Utah State with some of my friends to finish my first bachelor's degree. So that was fun being back in Logan. Then after I got my first bachelor's, it was in pre-human sciences because I knew I wanted to do medical. I just didn't know quite what. So I actually got it in pre-physical therapy. I thought I wanted to be a physical therapist. And then after I graduated, I moved up to Salt Lake and I worked at a PT clinic and I found out that I did not like it. I felt like I was trying to convince people to do their exercises and I was like, okay, this is dumb. It just wasn't for me. So then I decided to go back to school. One of my patients actually then passing was like, you would be a really good nurse. And I was like, I had never thought about nursing before. So I literally on a whim just applied to nursing school at Westminster and I got in. And I was like, okay, maybe I'm supposed to be a nurse. A lot of people getting into nursing, I feel like they're like, oh, I always knew I wanted to be a nurse. That wasn't really the case for me. Yeah, I had experiences in my life that I think looking back, I was like, oh yeah, I think this prepared me to be a good nurse. And so it was just interesting that I had never really thought I was going to be there. So then I went back to Westminster, got my Bachelor of Nursing, and then I worked up at the University of Utah for a couple of years in nursing. I did women's health. So the cool thing about the U is you kind of rotate. Like so different units. Okay. So it's like postpartum is originally where I started, but then we would do like antepartum for high risk pregnancy. We would do some step down NICU. Sometimes I would go to NICU, sometimes labor and delivery. So it was really cool. We got to rotate.
What was like your favorite?
That's hard. At one point, I almost switched to labor and delivery. I almost switched to NICU. I wanted a higher acuity of care. But then at that point, I had got accepted into nurse practitioner school that I was like, do I really want to have this high stress job while I'm trying to get through school? And at that point, we were going to start IVF. I had been on days. And for those type of units, it takes like 20 years to get on days. So you're on night shift for your entire life. And I was like, So I just stayed where I was at.
So you dealt with health issues early on in your life. I know that you mentioned you had issues with your thyroid, or did you know anything was off with your thyroid?
So when I was a junior in high school, it was actually the morning of our state volleyball tournament. I woke up and I was trying to eat breakfast and I couldn't swallow. It was the weirdest thing. And I was like, Mom and Dad, I literally cannot swallow my food. So we went to the emergency room. They choked it up to anxiety. They were like, oh yeah, you're fine, whatever. I was like, okay, whatever.
Like
I literally cannot swallow my food, but sure. So then I just vividly remembered because I missed the whole bus ride and it was this huge dramatic thing. I missed the first game. And so I got to state. And then it probably took a good couple of months of going to a specialist and no one could figure out what was going on. So there was that part of me too that as a provider, I really like to advocate for my patients and listen because I feel like a lot of patients get gaslit and, oh yeah, it's just anxiety. And you're just like, yeah, but I literally can't swallow my food. I think there's more to it. So eventually we found an ENT who ultrasounded my thyroid, and he's like, oh yeah, you have this huge growth on your thyroid.
So were they doing blood work and stuff and they're like, oh, your levels are fine?
Yes. It's hard because the emergency room, they're so busy. Obviously, there's people way more urgent than me. So I get someone like me. It's like, yeah, you can't swallow. That's not a huge deal. Your blood work looks normal. Just let us know how you do. And you're just like, okay. But yeah, ultimately, once we found this ENT, he found the growth on my thyroid. So what they would do is they go in with a huge needle, a biopsy, and they would go in and they would suck the fluid out. And it was so amazing because as soon as that was shrunk up, I could swallow again. And I felt like sometimes I would even have a hard time breathing because you can imagine just this huge lump in your throat.
But you didn't get that done for a long time?
Probably at least a couple months, if I'm remembering right. It took a minute. And also, it's hard to get into specialists. They're booked out. And so I think someone had referred me to him. They're like, oh, go see this doctor. And so when I went to that ENT finally, he was like, yeah, I don't think they could feel anything with palpation, which a lot of times often you can. But for me, as soon as they ultrasound, they were like, oh yeah, you have this huge growth on your thyroid. They would aspirate the fluid and that would shrink it. And for probably a good 3 to 6 months, that was my treatment plan. I would just go in every couple months. They would shrink it when it was bothering me. And then they would test the fluid. Every time they tested the fluid, they were like, oh yeah, everything's fine. It doesn't look cancerous.
But were they giving you a reason of why it was filling up with fluid? Or you just didn't know? You're like, okay, I'm going to have to just do this.
Yeah, they were basically just like, we just need to monitor this, make sure the cells and everything don't look suspicious. And then I just remember one time I actually was at UVU because your junior year for sports is really important. If you're trying to play college, that's where a lot of people get recruited. You go to all these camps. So I vividly remember being at UVU's volleyball camp trying to get recruited. And the very first day of camp, I got a call from my mom. And she told me that the cells had came back suspicious. It was starting to look like cancer. And so they're like, okay, you need to come home and get this taken out ASAP. And I just remember being in the parking lot bawling because I was like,
this is my time.
What junior in high school is having cancer? This is so weird. And I remember them telling me thyroid issues are super common for females, but no family history of this. And again, they're just like, you're super young. It's weird. This is usually something people find in their 30s, their 40s. Mm-hmm. So it was just kind of random that it happened. So then we went in, we took half my thyroid out. And then they basically were like, hey, you're going to be on this medication for the rest of your life because your thyroid does a lot. And if you only have half of a thyroid, you're going to need some support there.
So they got it all. You didn't have to go through radiation or chemo or anything like that. It was like, you're in the clear now.
Mm-hmm. They're like, if we didn't do anything, it probably would have progressed to the point where I would have needed the radiation and things like that. Which for cancer, thyroid's probably one of the most curable ones. So I guess in a sense, it's lucky that it's something that's really easy to treat. They put me on synthetic thyroid medication. And then my senior year, I just remember blowing up. I gained like probably 30, 40 pounds. My family's very tall and slender. I was never super skinny. I was very active, but as a girl in high school, it's hard. I just remember my whole identity felt like it had changed. I felt like I was struggling with this weight gain that girls in high school don't really deal with. And so I remember looking back, we went to Disneyland that year and I'm always mortified when I see photos. I was like, oh my gosh, that poor girl.
Did they put you on medicine that made you hyper or is it too much?
So like when they remove the thyroid, it's considered hypo because you don't have enough. So then yes, you take medication to help support that so that you're not in this low state of the weight gain, the fatigue because you're lacking the hormone.
So now you know what you know looking back. Do you feel like there was something your doctors could have done to prevent you from gaining all that weight, or was that just a predecessor to everything your body had been through?
There was definitely, like in functional medicine, we do thyroid completely different. So I think it has given me a really great understanding, and I'm way more empathetic for my patients who struggle with thyroid because they usually have the exact same experience that I did. They come in, they'll say, they said my levels were normal. They put me on levothyroxine or Synthroid, or number one big pharma medication that's prescribed across the nation. So that's usually what they're put on. And they'll tell me, I take it every morning. And I'm like, do you feel good? And they're usually like, I notice nothing. I just take it because they tell me to take it. And that's exactly how I felt. I was taking this medication because for me, I guess sometimes it's a little different because yes, I only have half a thyroid. So I have to be on it. But I felt like it literally was doing nothing for me. And so in functional medicine, we use different standards. The gold standard test for thyroid in the medical world is TSH. And TSH we're finding is not the best indicator of thyroid status. It's just hard because in the medical world, it takes years to change protocols, gold standards. So even if you go to an endocrinologist, TSH is what they use. But we're finding TSH is not the best predictor of how you feel. And so in functional medicine, when we're checking thyroid, we're checking a full panel. And it's crazy to me because it's a simple blood test, but no one ever checks the full panel. So to me, in my brain, it just doesn't make sense because I'm like, how can you tell someone their numbers are normal, but you're not looking at the whole picture? So when I'm checking thyroid, there's 3 or 4 other values I'm looking at. And usually the common denominator I'm seeing is maybe they do have enough of the hormone. Maybe that level is normal, but then there's something, it has to convert twice before your body can even use your thyroid hormone. And so there's something called T3 free. And if you're not checking that and you're not converting to the active form, my patients feel like crap.
What does the thyroid do for you, first of all? Because I've had a lot of people say, have you gotten your thyroid checked? Like your hormones, how much does thyroid play into weight gain and hormones and all of that?
I mean, it's everything. It's the leader of all of your hormones. Yes, there's other downpour. There's lots of hormones playing a role, but your thyroid's almost like the commander. It's in charge. So you can imagine if your thyroid isn't functioning, the downpour of that is probably a big reason why maybe some of your other hormones aren't working properly. What does it do? It's temperature regulation. So a lot of my females or males tell me they're cold all the time or they're hot all the time. Your thyroid is almost like your thermostat. It's basically trying to keep you right in this normal level. So if they're telling me they have heat intolerance, cold intolerance, I'm like, that's your thyroid. They tell me they're losing their hair. It's brittle. It's falling out. That is your thyroid. If you're having trouble losing weight, or even on the other end, like you said, hyperthyroid, if you start to get too much, it could be you're losing too much weight or you're having a hard time keeping off weight. It can impact your bowel function. It can impact your mood. There's so many different things that it impacts that I think when I'm going through this list of problems, they're always like, oh, yep. Brain fog is a big one. People are like, oh my gosh, I can't recall anything. That's all of your thyroid.
So if somebody, a lot of people struggle with their hormones, with their health, and I'm sure we're going to get so deep into this, but if they're like, okay, something's off, I need to go see a doctor. Most of the time they'll go to their primary care doctor and be like, can we just do a full panel, test everything? And then the doctor's like, everything comes back normal. But then you find out, I guess first would maybe be seeing a functional medicine doctor, right?
Yeah.
But how can you advocate for yourselves, or when it specifically comes to thyroid, what should you be asking for to actually get your thyroid checked to actually know if it's working properly?
Yeah, no, that's a good question. I think a hard thing with Western medicine is they're run by insurance. Insurance dictates how you do things. So a lot of times maybe they're not checking specific labs because they know the insurance isn't going to cover it. So I think it's just important as a patient to call your insurance, be like, hey, do you guys cover these labs, first of all? And if they do, or if you're okay with cash pay, then just advocate to your provider. A full thyroid panel, you're looking at TSH, you're looking at something called T4 free, you're looking at a T3 free, which is probably the only one I care the most about. And then TPO antibodies is the big one I'm checking as well for Hashimoto's. Because again, I will tell you, I don't know if it's just Utah or what it is, but 1 in 4 females I'm checking usually has Hashimoto's.
If that test comes back normal, is it like, oh, you don't have Hashimoto's, or is there more diagnostics?
There's other antibodies as well. I would say if they usually come back, it's usually the TPO is the most common one to come elevated, but there's also something called thyroglobulin. So there's other antibodies, but usually I start with the TPO because if any are going to be elevated, it's usually that one.
Do you have a good memory?
Yes.
In general, you're just whipping out all of this stuff and I'm just like, whoa, I can't even remember my name some days.
Yeah. My husband will laugh if he ever listens to this, but I feel like I do kind of have a photographic memory, which I think is what made school really easy for me. Like I could study something and then when I'm taking a test, I could close my eyes and remember where I saw it on the page and be like, okay,
yeah,
it was
that's
that.
literally photographic memory. Oh, I would kill for that.
So I think that's what really made me really good in school, but then he'll argue that I'm sometimes just not street smart. He's like, you're literally the smartest person I know, but then
just like normal.
Like normal like directions or something. He's like, how can you be so smart but yet not at the same time?
So you were on this medicine in high school. You gained a bunch of weight. How long did that last for? And did you find any relief?
Oh, I mean, we're talking. So senior year, you're what, 18? I was probably on that for almost 10 years.
Was your weight remaining that same? Or?
Yeah, playing college volleyball. You're doing 2-a-days. You're so athletic. You're so in shape, but my body never showed that. I remember there was one point in my college coaches were like, oh, maybe you should lose some weight, because for me, it was just super hard. People with thyroid issues, you have to put in 10 times the amount of work to reflect what a normal person does. I guess in college, yes, maybe I could have eaten better, but being that active, it did not reflect, which I think was super frustrating because I was working so hard, feeling so exhausted. Yet all my other teammates looked amazing and they'd be like, oh yeah, you should probably lose some weight. And I was like, okay, I'm trying here.
So what was the catalyst for change? I'm going to a different doctor. I'm going to figure out something else. What happened to switch into a different lifestyle?
Yeah, so I didn't get on desiccated thyroid probably till a couple years ago. I'm trying to even remember who was the first doctor that put me on that. I think when I was working up at the U, someone had told me like, oh, my sister sees this great provider for thyroid. If you're not feeling good, you should go see them. So I ultimately went to this different provider. And then that's when they did that full test. And I was like, oh my gosh, I've never had all these levels checked before. And that's crazy because I have half of a thyroid. Why have you never checked these levels before? And so the minute I got put on this desiccated thyroid, a month later, I think I lost like 10 pounds.
So what's the difference between the desiccated thyroid and the levothyroxine, other ones that you were on?
So the synthetic stuff, anything with synthetic, I just tell my patients that's not natural. It's made in a lab. It's just something your body doesn't recognize. So yes, there's a time and a place for it. Every once in a while, I'll get a patient that feels good on it. For me, I'm never going to change something for a patient if they feel good. So it's not like I'm going to be like, oh my gosh, it's synthetic, you can't take it. I care about how you feel. So if a patient comes in and they feel good on it, I'm like, great. You're one in very few patients who do, but I'm glad that works for you. I would say majority of my patients, though, feel good on the desiccated, which essentially is made out of pig thyroid. So it's natural ingredients. So I guess the only patient who wouldn't really be able to take it is someone who's vegan or can't have pork product.
So it would be replenishing the loss that your body's having with actual thyroid. Wow.
So when you're looking at the synthetic stuff, that's made up of T4. So if you are familiar with the conversion, TSH converts to T4. T4 still has to convert to T3. So if you're having a conversion issue and you're just fueling T4 and you still have to convert, I think that's where patients are still not feeling good, where the desiccated thyroid is made up of T3 and T4. So for me, yes, it's a medication, but to me, it just makes sense that A, it's natural. Your body's always just going to respond more to natural ingredients, but also you're supplementing that T3, which is the active form of thyroid.
What's that process of switching over? Do you have a lot of patients that come to you that are on a synthetic that say, I want to be on the other one? And is that a withdrawal process, or does that mess up their thyroid levels by having a transition?
Yeah. So if they're on a super high dose, maybe they're a little hesitant. They've been on it for years. You could slowly wean off as you increase the other one. Most of my patients, I just have them completely switch over because you're still getting the T4. Most of my patients, they just feel really good on it and they hardly ever have side effects.
Was it just life-changing when you got on that? You were like, holy crap, I feel so much better.
Oh my gosh, yeah. And again, I'll tell patients, yes, I use that story a lot, but it's obviously, everyone's not going to have the same experience. Yes, I say I lost 10 pounds. I don't like to set these high expectations that I'm like, oh my gosh, you're going to get on this and lose 10 pounds. For me, it was life-changing. But for a lot of my patients, they feel really good on it. Even if it's not the weight loss aspect, maybe they're like, oh my gosh, I actually have real energy. I had a patient a month ago text me 3 days in on it. And she's like, I woke up with real energy for the first time today. Whatever symptom they're struggling with, just hearing that and validating what I'm doing. Sometimes I'll get patients who go back to their OB or something and they're just like, what is this doctor doing? Who are they? Because it's not conventional medicine. And I just kind of have to let that roll off because sometimes it gets to you. You're like, oh yeah, they think I'm just this witch doctor or something. My patients feel good and they keep coming back to me. So at the end of the day, that's what I care about.
Totally. So you were also dealing with a lot of personal grief as well. You lost your brother. When was that?
Yeah, so I believe I was 21 because he was 26 when he passed away. Honestly, that time of life, I even just started therapy for the first time because I was like, I should probably address some of this.
Yeah.
And I feel like what I've recalled talking in therapy, your body kind of shuts out some traumatic things. So very traumatic thing like that, I think I did block out a lot of it. But I think I was about 23 or 24 when it happened.
Obviously devastating and heartbreaking. How do you feel like grief plays in with your hormones in your body? Did you notice a huge shift during that time?
I kind of fell into old habits. At the time, I was dating my ex-boyfriend who I was on and off with for probably 5 years. So I ran back to him and I pushed a lot of family and friends out of my life. I'm actually LDS. And at that point, I stopped going to church because I just felt very angry at God. So I'm sure my hormones were out of whack and cortisol was probably through the roof. But also, I'm just a person who kind of tucks things away. Didn't really deal with it. So I think I'm now dealing with it.
How is that, dealing with it now?
I'm finding things just in therapy that maybe I have resentment towards certain people or certain things that I didn't realize were there because of his death. So it's interesting. Yeah, I'm devastated. I lost my brother, but I'm realizing how much it's impacted so many other of my relationships because I didn't realize my resentment was towards this because maybe it impacted my brother in that way. Or maybe I have a lot of guilt because I was up at Utah State at the time and I'm like, oh my gosh, I was gone.
Unpacking all of these things.
Yeah.
This is why.
Yeah. And so I feel like I just didn't really deal with it. So I think it's honestly really good therapy. I tell a lot of my patients, obviously the best model is everything: mental health, physical health, aesthetic health. If you want Botox, feel good. I feel like it all plays a role. And so I was preaching that, but I've never done therapy, that I finally was like, okay, I should probably give this a try. And now that I've done that, I think it's been really rewarding to unleash all of that and be like, okay, I've been carrying this heavy weight around for so long and it's nice to deal with it, but also get it off your chest.
I think you probably get so wrapped up into helping others and your job and your life and the routine of that and losing yourself a little bit in your patience. Like,
oh, for sure.
Don't want to deal with my own stuff, but I will fix you. It's just like, you don't want to deal with your own stuff, so you'll fix something else.
Oh, for sure. And that was a pattern with ex-boyfriends. People will joke I dated Prison Mike when I met him. He had an ankle monitor on. I was always dating projects, which is fine, but that was just for me, my personality. I love fixing problems. I like just helping people through their issues. And so that was a common pattern again through therapy. She's like, yeah, it just seems like that's your personality. You're drawn towards people who are struggling. And I'm just like, let me help you.
Let me fix you.
Yeah.
Is that your whole life growing up, or do you feel like after your brother passed away it really kicked into high gear, like, let me fix you because I couldn't fix him?
I feel like it's definitely just in general my personality. I'm number 4 of 8 kids and I'm a Libra. We're always just trying to balance and make things peaceful. And so I feel like I was always the peacemaker in my family. But then yes, when my brother died, I feel like at that point, I was just about to start nursing school. So again, I think it was another push that I had a lot of anger. I don't think he got great help before he died. And my goal for patients is, even from the mental health aspect, if I could be that listening ear for someone or be that reason that someone doesn't die or leaves this world, if I just saved one life, then my whole career would be worth it.
Yeah. How is your relationship with him like?
He was my best friend, and it sucks. Even when he died, I hadn't met my husband yet. So my husband doesn't even know who he was. It's been hard. I'm close with my siblings, but I wouldn't say I'm best friends with all of them. And he was probably the one I was closest with. So there's always like a what if, like if he would have met my husband, they would have been buddies. And even my 2 little boys, I'm like, oh my gosh, he would have been the coolest uncle. And my youngest boy, actually, who's 7 months this month, he has my brother's name. His middle name is Jeremy. Cute. And so it's just like even a cool thing that, yes, I want him to be his own person, but again, I just want my boys to know who he was. And I'm always just trying to talk about him because me and my siblings even talk every year. As it gets further and further, it's weird. You'll start to forget things and it's sad. We were like being like, I can't even remember what his favorite this was. You just kind of start to forget things. And it's weird that your life just keeps moving, even though he's stuck at 26, but he's my older brother.
Oh yeah, that was really hard when you hit 26.
Oh my gosh, yeah. He'll always be my older brother, but in a way, it's like I'm older than him. I have a family, I have kids, and he just missed all these big milestones that sometimes it just feels weird. Anyone who's gone through grief, I don't think it ever gets easier. You just kind of learn to deal with it better. And so I always, 2 times a year, his death date, his birthday, I allow myself to be very sad. I don't think it's also healthy to be sad and depressed all the time. However you want to grieve, though, whatever works for you. But for me, doing that twice a year really just helps me get those emotions out. And then the other days of the year, I'm always just trying to bring up in conversation and just always talking about him because I think it's just important that people know who he was.
Yeah.
Does your family do a lot to keep his memory alive, or has that been hard because they probably all grieve in their different ways too?
Yeah, I think it's hard. I don't know about your guys' parents, but I think that generation in general, from what I see, they don't really do therapy.
Yeah.
They think it's for crazy people. And I'm like, well, we're all crazy, so everyone needs it. But I think they could very, very much benefit from therapy, and they've never gone, at least to my knowledge. So I think obviously they grieve a lot different. I don't know what it's like to lose a kid. Yes, I lost a brother, but I can imagine now being a mom. That's a completely different beast. I know I can't comprehend what they went through. But I think it's just sad that generation, I'm like, therapy can be so great and so beneficial. Yes, there's crappy therapists out there. I think my therapist told me 80% of therapists suck. Even my brother, I think my parents said he had tried therapy. He tried it once and he hated it. And I was like, well, yeah, he probably had a bad therapist. That doesn't mean it can't be beneficial. And even looking back now on all the hormone stuff I know, I'm like, no one checked his testosterone. There's just this guilt in me that if someone would have checked his testosterone, maybe he still wouldn't be here. But maybe he would. I'm seeing younger and younger males. I've treated guys as young as 20 before with low testosterone and depression. Testosterone is huge.
It's a big indicator.
Oh my gosh. Testosterone is everything for a male, especially in LDS culture and Utah in general. I think there's a lot of pressure. You have to go on a mission. You have to stay clean. You have to get married in the temple. There's all these markers that I feel like they have all this pressure on them already. And then if you put on top of that their testosterone's in the toilet, they feel like crap. They're depressed, they're anxious, they don't have any motivation. So like I've treated a male before, super depressed, suicidal. His testosterone was at 280, which again, if you know testosterone, Western medicine will say anything above 280 is normal up until about 900. But again, like biggest thing with patients, I'm telling them normal does not equal optimal. So if you're a male and you're sitting at 300-400, that is not optimal. If you have symptoms, why would you not want to be on the upper end of optimal? So most of my males feel best around 900 to 1200.
So what about fertility? If someone wants to get on testosterone, but they're in the middle of having kids or wanting kids, does that hurt their chances if they're on testosterone?
It does. So there's actually something out there called Clomid or enclomiphene that most people are familiar, like a female fertility medication. It's actually what we put our younger males on, and it helps raise their testosterone levels, but it also preserves their sperm. So if they're still in the phase of, hey, I want kids in the future, I'm currently having kids, then yes, you don't really want to start with testosterone. I mean, you could, and you could come off of it, but I'm always educating. There's always that chance that it could impact your sperm where you need to use IVF or something like that. But with the enclomiphene, it's kind of the newer version of Clomid. It has a little bit less side effects. It's just a pill that they take daily. And it basically stimulates their LH and FSH, which are hormones to tell their brain, to tell their testes to make more testosterone and more sperm.
Yeah. Is there any natural kind of testosterone support that they could take as well?
Oh, yeah. There's all sorts of supplements. I feel like the supplement world can be tricky too. There's so much out there, but there's definitely ingredients and testosterone boosters that if they're even like, hey, I'm not quite ready for something like enclomiphene, that you could even do a natural supplement
like
as well.
Kind of that. So it's probably hard as you're learning more about the medical world, all the things that you could help. Yeah, I'm sure it triggers those thoughts with your brother. I wish they would have checked this or the mental health stuff, especially now you're in therapy. It's like, I wish he could have found.
Oh my gosh, yeah, because he struggled with ADHD, so he was on Adderall. So I think there was some substance things going on as well. I remember at one point they were telling me he was abusing his Adderall to the point where he was up all night. He wasn't sleeping, where you're just like, okay, you're obviously not in a good state of mind. And then I think he tried to cold turkey it and come off of it, which is obviously not the right way to do it. And so it just seems like he didn't get the guidance that he needed. And no one ever had the thought to be like, oh, let's check your testosterone. Again, simple blood test. Simple fix, and it just sucks that he didn't get that.
Yeah, you had mentioned these on and off again relationships, maybe not finding the best men to date. What was it like meeting your husband?
Oh my gosh. I mean, he was probably the first white guy I dated.
Okay. What's Kaysville? Are they just all these?
No, it is white central. But I think, again, I'm a very rebellious person. And I'm finding in therapy with 8 kids, sometimes it's hard. You're spread thin. I can't even imagine my mom being a working mom, raising 8 kids, trying to divide your attention to 8 kids. I have 2 and I feel like I'm spread thin. I think there was just some part of me that maybe I was really looking for attention and love there. Yeah, because I maybe wasn't getting as much of that at home just because my mom was spread so thin that was drawn toward more of those bad boys. And that's my typical dating scene. I feel like I dated everything but white. And I mean, at Davis High School, yeah, you have like 2 Polynesians, 1 black kid. So it's not like I grew up around all these diverse population. But once I got to college, 2012 was right when Tinder came out. That was probably my downfall. I'd just get on Tinder and every night I was like, oh yeah, go out, go out, go out. Yeah. So when I met my husband, it was crazy how he met. He actually met my mom, who didn't like my ex, obviously, at the time. And so she told him, she was like, oh, my daughter's single. You should ask her out.
How did they meet?
So he is a salesman. In the time, he was doing teacher microphones for teachers. It's so random. It's like such a random thing.
Niche.
Yes. But he was at a school. He wasn't even supposed to be there. It wasn't even his territory because my mom's in Kaysville. And they were basically just checking all the teacher microphones. And my mom's room wasn't even one they were supposed to check, but it was the very last room. And I guess he said he had this impression to just go in there and just make sure, hey, do you need anything? And it was my mom's room. So they just started talking. And at that time, my little sister was in my mom's class. And they said something about, oh, we have to go to volleyball practice. And he was like, oh, you guys play volleyball? Because I guess volleyball girl was number one on his checklist. That was like his type. And so he just kind of perked up. And she was like, yeah, all my daughters actually played college volleyball.
Like, tall?
Yeah, she's 5'11" and I'm 5'10".
Okay.
She actually played college volleyball at Utah State.
Okay, cool.
So I come from a very extensive volleyball family. And so they started talking about volleyball. And then she had mentioned I played at Slick. And he was like, oh, I played at College of Southern Idaho, CSI. And they're in the same conference. And he was like, oh, what year? And we were both the same year. So he was like, oh my gosh, maybe I know her. He's like, let me see a picture. And my mom showed him. And he was like, oh, she doesn't look familiar, but I think he said something where it was like, oh my gosh, I know her. But he was like, no, you were just hot and I just wanted your number. So my mom was like, oh yeah, here's her number. She's single. And I remember
offended. You're like, no, I literally have a boyfriend.
Yeah. I remember sitting by my boyfriend and I got this text that was like, hi, your mom gave me your number and I'd love to take you out sometime. And I was like, oh my gosh, I am so sorry. My mom is wrong. I'm not single. And I remember he said it was the nicest denial he ever got. And don't ask me why I denied it this way, but I guess I told him I'll save your number just in case. And I remember looking at his Instagram, and again, he was white, and I was like, not my type. So then months later, I had this falling out with my ex, and I think it was on Snapchat at the time, right? When we used Snapchat, maybe they still use it. I don't know, but I was running or something, and he responded to my story, and then all of a sudden we just started talking. We went on a first date. And it was in that moment, I was like, holy cow, I'm going to marry this guy. It was insane.
It was just totally different.
Oh my gosh, yeah. And I remember going on a drive with him because I was with my boyfriend, but not really. I always knew I wasn't going to end up with him. Again, I think the grief of my brother, that loneliness, I always just went right back to him. And my husband, I remember going on a drive and he was like, I promise if you choose me and stick it out, you'll never regret your decision. And so here we are almost. Yeah.
The salesman. He's like, do you need a microphone? Because I'm your guy.
Yeah. So we're 8 years later and he's my best friend. And I'm just feel really lucky that I don't believe in soulmates. I think we're compatible with a lot of people. But I think my mom at the time was really praying for me and really worried about me that I think a lot of people called it divine intervention, that he was literally just placed into my life at that point.
Was like, I need to fix him.
No. Oh, no. So if anything, he probably needed to fix me. He was probably like, oh, this girl's got so much crap going on.
Was that a hard adjustment to go from dating projects to, oh, this guy doesn't need anything?
I think it was, because I think I had this red flag being like, why is there nothing wrong? You know what I mean? I was like,
the other foot to drop.
Yeah, I was like, what is it? There's got to be something. And I'm just waiting and waiting. And I was like, oh, you're just a good guy. You don't have any baggage. I think I was probably at that point so broken, and he saw that, but I think he saw the potential. I feel like he was like, let me help you. And I promise, like, you'll never regret it. And he's still that amazing. With how busy I am working and doing all the things, I feel like I never see my boys. And he's always just giving 110 to make up. And he's like, it's fine. It's just a phase of life. And I just really love that about him. Whether I'm giving 20% or 100, he's always making up for what I'm lacking. And I think that just is really what makes a good relationship.
That's such a good way to look at it, in such a healthy way, because you're going to need, or you're going to need to give.
Exactly. And in this stage of life, I feel like I'm always the one that's down here. And I'm like, hi, babe, help me.
Give me.
Yeah.
No, but also I think being a woman, there's another layer where you're working and the mom guilt. Why as women do we feel so guilty for providing and being successful and trying to fill our cup with a career or whatever that looks like? And then you feel like, I need to always be home with my kids too. Is that just being a woman? Because I don't feel like men feel that way.
Oh,
they
for
have
sure.
to go work.
That's probably the biggest thing I'm dealing with right now. It's the days like yesterday. I didn't see my youngest. I left before he woke up and I got home after he was in bed. So you just come home and I just have this instant guilt of being like, oh my gosh, is he going to have this trauma that his mom was never there? I know they're young and they won't remember it, but I think I just have to remember my therapist even telling me to. They're going to know you did all of this for them. My goal is when they're older, hopefully I'll be at a spot where I sacrifice now that I can have more flexibility and only work like 2 days a week or things like that, where my school loans are paid off so that I can really be 100% present. But I would say the mom guilt's probably the hardest thing, being a working woman, because I genuinely love what I do. I don't feel like I'm working when I'm working. I love helping patients. I feel really lucky because I feel like a lot of people just in general maybe don't have that. And genuinely, when I help someone and I'm talking to them 3 to 4 months later and they're just like, oh my gosh, my marriage is saved. I want to have sex with my husband again. I'm not depressed. Best thing I've ever done. It makes it all worth it. The long hours and all of that.
I feel like I have a lot more compassion for my mom now being a mom.
Oh, for sure. And that's also something I think I found in therapy. I think I've been pretty hard on my mom. And I think I'm coming full circle at just seeing this perspective of my mom worked her entire life as a school teacher. Oh my gosh.
And then comes home to 8 kids.
School teacher. I cannot respect them enough. They do not get paid anything. You're literally babysitting 30 children. And then to come home to 8 children, where my dad grew up on a farm. And I feel like he was very much raised on the woman does the inside, the man does the outside. And so I feel like she just had all this pressure to have food on the table. But she's exhausted. So I think just through that too, I've just come to really love and respect my mom in that aspect. I'm like, oh my gosh, you did so much. You were always at my games. But yes, maybe there were obviously other things that weren't perfect, but I can tell that you were trying. You were probably at 10% the entire time, and you were just giving that 10% that you had because that's all you had left when you got home.
And there's also that evolution of your relationship you can have with her now.
For
where
sure.
it can constantly be growing and changing and becoming friends and forgiving, all the things. What's your relationship like with your dad?
I feel like we were actually in a worse spot a couple years ago. Again, losing a child, I think that's like the number one reason people get divorced. It's really hard to overcome losing a kid. And I think their marriage has really struggled, but they've done a really good job staying together. Not saying that maybe it's always in the healthiest ways, but I feel like there was one point I was really upset at my dad and I was like, you need to change these things. I just called him out. And since then, he's made like a 360. So I even told him this Father's Day, I was just like, I'm so proud of you. I feel like a lot of people can't take constructive criticism, which I know sometimes can just be criticism, but I try to make it constructive. And so I feel like he's come a long way since I called him out. He's always showing up for grandkids and he's just really making an effort. He'll drop work to come watch my kids for me. So yeah, I feel like we're in a lot better spot and he's really responded to my call to action. I was like, hi, if you don't do these things, I'm not okay with this. And then he really turned that around.
That's the best as a child. If a parent can respond to that, what a healing moment.
Oh, sure.
Like, it's not overnight. Like you said, a few years in the making of, okay, you're showing up, you're doing these things.
Oh, yeah. So proud of him. And he was always the one growing up too. He would always joke to me. I can always hear his voice. You should be the doctor someday. He would always say that to me. So I think it's cute every time now we were talking and he'll just be like, I told you you're smart enough. He was just always that voice in my head that like, going through nurse practitioner school, I was like, my dad always told me I could do it. So it was just really cool when I got to that point. I can picture myself as a little girl, him telling me that and then watching where I am now. It's just so cool to see.
Totally. So you finish and you become an NP. How was that in the world of medicine? Were you just still Western medicine at this point?
Oh yeah. As a new grad NP, I feel like you're really just trying to grab whatever job you can get. So I remember we had just had my first son. I took my exam 3-4 months postpartum or something like that. So at that point I had stopped at the hospital, took some time off, and I basically was just looking at jobs all day. And I literally didn't really know what I wanted to do. I did a lot of urgent care clinicals and I was like, oh, maybe I'll do urgent care. But ultimately, I think networking is the only way to get a job these days. It's all about who you know. So back in the day, I had shadowed this NP who did Botox, all that stuff. And that's honestly where I thought I wanted to work. And so I had shadowed her. I did a full day and I was kind of like, I didn't love that. And so I still had all of her contact info. And I remember just reaching out to her because she owned her own practice. And I was like, hi, do you know of anyone hiring? And I guess at the time, I think she still currently does. She does like an NP program where she teaches people to open their own clinic. And so she was like, oh my gosh, I actually have this client who's trying to open their own clinic and she is looking for an NP. And so she gave her my info and then I interviewed there and I got the job. And so they were basically doing everything I'm doing now. They're doing functional medicine. It definitely was a startup. So that was a lot to work just starting from the ground up. I didn't really know I was going to get into functional medicine. It just was the first job I got. And I still remember the first hormone conference I went to. My mind was blown. I remember being like, I did not learn any of that in school. Where was this my entire life? And I was ready to change the world.
You're like, let's go.
Yeah, because I recall in my NP school, one hormone lecture, and it basically was for postmenopausal women saying, you're going to feel like crap and that's okay. That's normal. Take a little estrogen for your hot flashes and then come off of it as soon as you can. And that's what they teach you. And I was like, wait. Testosterone, progesterone, thyroid. They just emphasize my thyroid journey, the same thing of being dismissed until you're like, oh my gosh, I feel crazy because I feel like crap. So I just felt like I finally found my people. Like I found my calling.
That's amazing. So you worked there at the startup for a while.
I was there, and then I kind of jumped ship to a different practice and helped them start their functional side. I remember at the time, the place I'm currently at, they were hiring, and I was like, oh my gosh, this is my dream job. I don't have enough experience, but I'm going to apply. And I applied, I got the job, and I was just like, oh my gosh, I just feel so lucky that I'm at my dream job. I'm doing exactly what I love. It's so close to home. And I'm busy, and so I just feel really lucky to be where I'm at.
What would you say the biggest thing between Western medicine and functional medicine is?
If they can remember one thing from this podcast is normal is not optimal. I think the typical story we get is you go into your doctor, you're like, hi, can you draw my hormones? And like you were saying earlier, I think the biggest thing to advocate, a lot of times they're like, oh, that's not necessary. It won't show you anything. And I'm like, no, but please, I'd like these labs drawn. And you just tell them what you want drawn. So if they draw those labs, then from there, a lot of times the patients will tell me they go in, they get a 10, 20-minute visit, if anything. And they'll be like, oh, everything looks normal. See you in a year. And you're like, excuse me? I have these 10 complaints and you just said all my labs are normal. So then they start to think they're crazy. Or if they mention depression, they're like, oh, get on an SSRI. Which again, there's a time and a place for it, but I don't think it's always getting to the root cause. It's just kind of a Band-Aid, which some people need at the time. They're like, hey, I'm in a really dark spot and I need this right now. And that's great. But sometimes maybe it's just your hormones. Maybe your progesterone's low. Maybe your thyroid's off. Maybe your gut's off. There's a lot of reasons why people could be feeling the way that they are.
So even if they say everything came back normal, your labs look normal,
Range
isn't but is it optimal? Like where even 280 testosterone is normal.
And that's where they'll only start covering a male as if it's below 280. And that's basically where they feel like they're dying.
Which is
they
crazy.
Could be having symptoms at like 400 before they get all the way down to 280.
Because I've had labs or things where it's like, it's in the normal range, it's a little bit of the lower range or whatever. And then that should be a red flag in my mind of like,
red flag.
Lower normal is not optimal.
I mean, if you were to ask any patient, do you want to be in the lower 25% or would you rather be in the upper 75% of patients?
Just for your overall general health.
No one's going to choose.
You should aim for that.
No one's going to say, oh yeah, I want to be on this average lower 25%. It just doesn't make sense to me. Mm-hmm. And then if you have to think reference ranges, I have to explain to patients. It's like putting everyone in the same box. It's so hard to have a reference range because everyone is so different. Yes, it gives us a really good idea of where you're at and where we could be, but a reference range is usually pulled from a sample population. So let's say we checked 5,000 people in Utah and we checked their testosterone levels. If 80% of them are deficient in testosterone, the reference range is going to be skewed. So even though it's saying 2 to 900 was the average, if everyone's running at 3 to 400, that is not normal. Mm-hmm. So I also have to explain to patients, yes, the reference range, that's what we're always looking at and comparing to. But again, I'm going off of symptoms. So I'm not really chasing a number for my patients. I'm really trying to be like, are you feeling better? Obviously, we don't want side effects, but I really just want you to feel good and be optimal, which for most people is that upper end of normal.
With a Western traditional doctor, I feel like I've been in this scenario and they send me away. At that point, are you like, find a functional medicine?
Yeah, I feel like you should get multiple opinions. I don't think you should just put all your eggs in one basket and be like, oh my gosh, they told me everything's normal and just go on for the next 10 years. A lot of my patients come in and they'll be like, multiple providers told me this was normal. So they've already looked at 3 or 4 different people. And I think that's amazing that people are starting to realize there's other providers you could look at. It's not like you just have to go to your PCP or your OB. I think there's definitely a time and a place for those people. And they're some of the smartest people I know. So I never want people to think I'm dissing Western medicine because even in my clinicals, some of the smartest people I know. But But I think, again, there's different specialties. I don't think they're doing hormones all the time. In my schooling, I had one lecture on hormones. So I don't think it's them trying to dismiss you or trying not to listen. They just don't understand it. I think 80% of my patients are hormones. So I get a lot of those patients because it's what I do all day. So you just have to remember too, if someone's not doing it all the time and they aren't as familiar, I don't think it's necessarily like they're trying to make you feel like crap. I just don't think they're as comfortable doing hormones.
Functional medicine, you would say, is holistic and Western combined. Is that how you would classify?
Yeah, because it's never like I'm anti-medication. If someone comes in and they're on things, it's never my goal to be like, oh my gosh, you need to come off of these medications. Let's start with where are your symptoms at. Is there anything we could come off of potentially, but let's really see if there's anything missing. Have they ever checked your gut? It's usually no. Have they ever looked at your hormones? It's usually no. My females are like, oh, we can check testosterone. I thought that was a guy thing. I'm like, no, testosterone is your most dominant female hormone. We just don't have as much as a male. So I think there's just misconceptions. They're like, oh my gosh, I didn't know I could do all of this testing. So I do sometimes use medication for things. Sometimes birth control can be a good option for people. Do I love birth control? No. I think I'm just more in the middle. I do love research Western medicine, but at the same time, I think Western medicine is trying to catch up to where we're at. We're just doing a lot of things off label that's not FDA approved because insurance will never cover it or things like that. But we're just almost trialing things, and that's where our patients feel good. So that's kind of a mix of both.
If someone's wanting to try functional medicine, would you be like, okay, it is more of an investment. It is going to cost more, or does insurance cover a lot of stuff?
For sure. I think a big reason people don't go that route is because of insurance. I get life's expensive. If you can go see someone who's covered, I totally get that. But that's where I just tell my patients, you could either invest now and prevent yourself getting from a worse state later on, or you could just see your PCP and then maybe they dismiss you. You have all these symptoms. And then finally 10 years later, you have all this PCOS, insulin resistance, inflammation in your body. And then we're dealing with this bigger monster because we didn't deal with it earlier on.
Are you covered with insurance?
We are not. Cash pay.
And how do you feel about that? Are you like, I hope the insurance will eventually...
Oh, yeah. I hope. I'm not banking on it.
Why doesn't insurance cover it?
A lot of the modalities we're doing or things are considered off label, so they won't put their hands on any of that. Testosterone for a female, a lot of times I'm boosting them a lot higher than the reference range, and they're not going to touch that.
So it's more of a liability thing.
Mm-hmm. Sometimes with my patients, if they think they have good insurance and they want to do blood work that way, that's one way I can often get done through their insurance. We don't accept insurance, but what I'll do is, here's the labs I want, go take it to your PCP or go run it through your insurance. Hopefully it gets covered. If it does, then come back to me and I'll go over the results with you. Sometimes that can save a little bit of cost, but most of it is usually cash pay.
So a reference point, what can they expect cost-wise going the functional medicine route?
Yeah, so how we have it laid out, we offer free consults. So if they want to just sit down for 30 minutes to just even see if it's a good option, that's free. Because I feel like it's really just establishing that trust and relationship, because I know I'm not a good fit for everyone. I think that's a big thing, is sometimes you just mesh with certain personalities and sometimes you don't. So I think that 30-minute visit is really important. What am I getting into? What do you do? So that's really where I say, hey, what are your concerns? And then I'm honest with them. I could help you. I couldn't. I'm the first one to say, the more I know I don't know. I think it's a red flag if a provider acts like they know everything, because if they're not going to conferences every year, if they're not constantly learning, I think that's not fair to your patients to act like you know everything when you don't.
And things are changing and there's new medicines and there's new ways.
And that also means you're humble enough to go out and learn it. I actually don't know. Let me look into that. Let me research it. Let me figure out if this would be a good fit for you.
Yeah. I'll be the first one to tell my patients in a consult, if there's a concern they have and I have no idea, I'll be like, I honestly have no idea. So I'm not going to bullshit them and be like, oh my gosh, yeah, I exactly know what to do. So that's really where I try to just make sure we're a good fit. I can actually address their concerns. And then from there, we'll usually start with blood work. Because I would say 80% of my patients coming in, it's usually for a hormone reason for the most part. We're like, okay, let's start with blood work. So then again, they could maybe even go through insurance if they wanted to, if they think they have good insurance. If they don't, blood work, you're usually looking $250 to $300 for blood work. But again, it's not a standard panel with your normal provider. It's such a robust panel. We're checking all of your hormones, including testosterone. We're checking the full thyroid, not just a TSH. We're checking vitamin D. We're checking B12. We're looking at inflammation markers. So there's so much more we're looking at rather than just the typical red and white blood cells, metabolic panel, TSH is usually the standard panel patients come in with.
Well, people probably come in with some overlapping symptoms. I get scared when I go in that I'm not going to explain it very well, or that I'm not going to say the right symptom or something for them to dismiss something else. Do you guys typically run wide open? Let's just check everything. And by everything, I mean everything, to see what's going on with this patient? Or is it like there's those trigger words of like, oh, they mentioned the temperature with the thyroid, then you know that's thyroid, I'll check that? Or do you just baseline check it for everyone?
We usually baseline check everything just to make sure we're not missing anything else, because like we said, thyroid, a lot of times too, the hair loss, I'm like, oh yeah, that's your thyroid. But also sometimes it could be someone's iron and ferritin. As females, we're bleeding all the time. Yes, I can assume maybe I know where we're going to go with the treatment plan, but sometimes I'm like, oh, their thyroid was actually really good, so maybe it is something else. How we have it set up is we check everything, and even sometimes I'm adding even more in based on their symptoms. I think we actually need to go this direction, or we don't need to do hormones. I think your gut's really out of line. Let's check your gut health. So I think the consult's really important to pinpoint that. But yes, I would say the average person, we're really checking mostly everything from a blood work standpoint.
When you say gut health, what is that? Is that a blood test? How would you check gut health?
Yeah, there's two common scenarios I see. A lot of times if we're dealing with inflammation, we can do a food inflammation panel where we're really checking food triggers. Another big misconception though is I don't think everyone always have the typical gut symptoms. Sometimes fatigue, sometimes brain fog, that could be manifesting if your gut's off. Your skin health, there's a lot of other things. So if we're going that route, sometimes we're doing a blood test. It will check over 250 types of food, and it will show me exactly what's causing inflammation in their gut, which a lot of times that's causing a lot of their issues. If they're like, hey, I know which foods are bothering me, I really don't need to go that route, then sometimes we'll do a stool sample where they send in a stool sample, then the lab processes it, and it will show me exactly what's going on with the good bacteria, the bad bacteria, if there's parasites, if there's worms, H. pylori, all the things, which I don't think I've ever seen a perfect stool sample.
There's always something going on.
There's always something. I think sometimes people don't prioritize gut health. They're like, oh, I'm fine, I don't have symptoms. But sometimes even if we start with hormones, or even like you were saying, maybe if you're having anxiety and your medications aren't working, maybe you're not absorbing properly, maybe your gut's off. Because usually it does work, but maybe it's not working because your body's just inflamed and you're not absorbing things properly. So you're not getting the full benefit of the hormones or the medications.
Do you ever feel defeated? Like, I cannot figure this out and I want to help this person and I feel so helpless right now.
I mean, again, I don't feel like I know everything. So I guess maybe every once in a while you'll just get like a weird symptom. I would say derm's probably my least favorite subject. It's so hard. Someone will come in with a little rash or something and you're just like, I have no idea. That's probably the one I get most beat up about. Oh my gosh, I don't know what that is. So that's probably my least favorite. A lot of times I'm referring to derm because they all look the same to me. So maybe in that aspect, sometimes I get defeated. But one time I had this female, chronic acne, 10 years on Accutane. Going into it, I was kind of like, crap, what am I going to do for this girl? But I was like, let's just check your blood work. Let's see if anything's off. And then all I could really see from her hormones, her iron and ferritin were nothing. Your levels are really low. You need an iron transfusion and probably a couple of them. I was like, are you tired? And she was like, no, not really, which was weird because I can't even believe you're walking around with how low it is. So she got 2 transfusions. She wasn't local, so I had her go somewhere else. I called her 3 months later, and I kid you not, I probably will never forget this story, but she was in tears. She was like, my acne's gone. I've struggled with acne for 10 years. I've been on Accutane my entire life. Just cystic, never goes away. And she was like, I literally did 2 iron transfusions and my acne's gone.
That's amazing.
I feel like there's sometimes things I'm like, I don't know how I'm going to help you. But I think if you just think the body through, your iron, it's your oxygen, it's your blood flow. So to me, I was like, okay, that kind of makes sense because maybe you just weren't getting good blood flow to your face. Who knows? Maybe it's not related and maybe it was a coincidence, but it was probably one of the coolest stories I've had that I literally felt like I didn't know what I was going to do with her because I wanted to give her testosterone, but sometimes that can make your acne worse. And I was like, well, I'm not going to do that. So I was like, okay, I don't know what I'm going to do for you. I don't want you to be on Accutane. And we literally just did 2 transfusions and she said it was all gone. She was just like, I can't believe that I was functioning at that level for so long.
But even with acne, everyone's so different. It's your cause of these things. And when you go to a dermatologist, they're like, hey, spiralactone, birth control.
Well, they just say it's hormonal. That hormonal blanket statement is kind of just like, oh, it's hormonal acne. So basically incurable.
And I don't think I've ever gotten my blood work done when I've gone to the dermatologist. I don't think ever.
Me either. And I was on Accutane, so.
I know. One, like you said, the birth control, they kind of just slap that at everyone. It can be a good option.
And when you're 17 and they're like, this is going to clear up your skin, you're like, sweet.
Yeah, you're
like not
sweet.
thinking through the side effects or what it's going to do to you.
I think my biggest pet peeve is they don't talk about risks. I have so many patients come in and they're like, yeah, they put me on birth control. And I'm like, did they talk to you about your risks of birth control? And they're like, no. And there's risks with everything. There's risks with hormones as well. So I feel like it's our job as a provider. I'm never going to tell you what to do with your health. My job is to educate you the best to my knowledge and say, this is what I've seen work. This is probably what I recommend. But like at the end of the day, you're not going to be compliant if you don't feel good with the plan. And so I think my biggest pet peeve with birth control is they just throw it at everyone and it's a Band-Aid approach and they don't talk about risks. There was actually a study that came out in March this year that I was looking at. And it was showing your risk of breast cancer being on oral birth control pill or the IUD increases by 30%. They're never telling anyone that. And yes, there's other risks like sugar. We all have our sugary coffee in the morning. Yes, that's a risk for cancer. Alcohol. There's other things that could play a role, but sometimes I don't think we're giving patients the full story so they can't make that educated decision.
Yeah, because at the end of the day, it is their decision. But as a provider, it is your responsibility to lay out the full picture.
And literally be like, if this is the path you choose, this is what it's going to look like in your future when you're off of it or when you're on it. If this is the path you choose, this is what it's going to look like.
Yeah, because even just getting on venlafaxine, they never told me anything. They were like, let's try it. And then when I told them that I wanted to come off of it, they were really hesitant, like, no. And then finally I was like, why? I want to get off of this. And they were like, okay, so it's notoriously hard to come off of. There's horrible withdrawals. It's going to take you 6 months to a year to come off of it. And I'm like, why the hell would you put me on this without telling me that?
Yes, you're like, we didn't even have this conversation.
And the withdrawals for that was horrendous for me. I would have never gotten on this medication knowing how hard it was to come off of it.
Oh yeah, maybe they're just not knowledgeable about it. And then I'm like, okay, then why are you prescribing this if you don't understand all the risks? The low dose naltrexone. Vivid dreams is the first thing I tell them. If you wake up with a freaky dream, I'm sorry, but that's probably the low dose naltrexone. It is our job to educate you the best to our knowledge. And if we're not up to speed on that, you should have no job prescribing that.
Okay, you guys, today's episode is sponsored by Cozy Earth.
We've both been using their bamboo sheets and I am obsessed.
I know. They are butter.
The softest sheets I've ever felt in my life. People always equate the gold standard to hotel sheets, and I've never understood that. I go to a hotel, I'm like, these are scratchy, they itch. I do not like them.
They're starchy. These are the opposite of that. You get in and you want to just rub your body all over because they're just silky, buttery, smooth.
And cooling. They're breathable luxe sheets. They're lightweight and actually help you regulate your body temperature while you sleep, which is a game changer.
And did you actually know that when your body is cooler at night, it helps you produce more melatonin, which helps you get a deeper sleep? And being cooler at night also helps you produce more serotonin, which means you wake up in a better mood.
Yes, please sign me up every single night.
Being cool at night is so important.
Because have you ever just woken up in the middle of the night and you're just sweaty and like fever dream? Do you not know where you are? This is the exact opposite. You wake up feeling, oh, I just want to get in bed right now, honestly.
I know. And before we got Cozy Earth sheets, Hayden used to always sleep on top of the blanket, on top of our duvet cover, because he just hated how hot under the sheets was. But now ever since we switched to Cozy Earth, he sleeps underneath the blankets with me finally because the sheets are that cooling, which is a testament in itself.
If you want to try them out for yourself, go to cozyearth.com and use code Deepish for 40% off.
That is amazing.
Yes.
40% is actually crazy.
You get a 100-night sleep trial and a 10-year warranty, which you honestly have nothing to lose. I can't wait for you guys to try them out.
We know you guys are going to love them, so go check out Cozy Earth. And thank you, Cozy Earth, for sponsoring this episode. So let's talk about a lot of these things that have really strong medications. People can't sleep, so they go get on Ambien. People are anxious, so they get on anxiety or depression meds, or they can't focus, they get put on Adderall. All of these really hard narcotics or intense drugs to combat pretty normal human experiences. A lot of people have these things. If someone's like, okay, I think I'm anxious enough to get on medication, or my insomnia is so bad I really can't sleep, and they come to you, where do you start with that?
Hormones.
Hormones? It all comes down to hormones.
I want to say hormones is always the answer, but insomnia, anxiety, I can usually fix that in 80% of patients on bioidentical progesterone.
Really? So what about for a male? Is that the same
Testosterone.
thing? If you have a hard time sleeping, you probably have low testosterone.
Yep. So I actually just had a male come in the other day. I think he was like 24, 25. We did the enclomiphene. He came back 3 months later. All of his symptoms were resolved. He wasn't sleeping. He was depressed and anxious. He was having low sex drive. The list goes on and on. We had our little talk and he was like, everything's better. Again, it's not the answer for everything, but I would say most of the time, if it's not balanced, a lot of times that can help.
And that goes with everything. ADHD, anxiety, depression, insomnia.
I mean, ADHD, there's a newer thing coming out, methylene blue. I don't know if you've heard of methylene blue. It's the newer thing around the block. It's really neuroprotective. And what we're seeing is when you mix methylene blue with a little bit of caffeine, it almost has that same stimulant effect as an Adderall or a Vyvanse. And a lot of times patients are just thrown that because they're like, oh, you have symptoms of that, but they're not informed of how addictive of a substance it is. If you're looking at it, it's as addictive as freaking speed, right? It is a stimulant and it's really hard to come off of. And so when we're doing more natural things like that don't have as addictive qualities, they can still get the focus when they need it, but the next day they're not having withdrawals if they don't take it.
So what is that?
It's kind of hard to explain. It's this natural occurring salt and its natural color is blue. So everyone will ask me, is there dye in it? Why is it this bright blue color? It literally just is naturally occurring like that. And so what we do is we do it as an IV or we take it as an oral supplement, and it really is just neuroprotective. So they're actually studying it right now for dementia and these brain benefits and Parkinson's and all of that stuff because it's really, really great for your brain. There's just some really cool things that if I can try something like that first with a patient and they have good results, there's a time and a place for Vyvanse and Adderall. But maybe let's try least invasive first. If that's not working, then we slowly not just throw that at everyone and then they're addicted to it for the rest of their life. And maybe that's just a soft spot with me as well because of my brother.
Yeah. I have multiple family members who, like my dad's been on Ambien my entire life. And I'm like, want to take a weed gummy? So can we do something that's not as intense? Because he'll take one or two and then still can't sleep. So he'll bite off another half. And I'm like, Dad, you're literally going to overdose on Ambien. It's so scary.
Oh, I think Ambien's one of the hardest things to come off of.
Yeah. And so I try and think of solutions with him. In functional medicine, do you guys do a lot with marijuana or THC?
Yeah, we actually do medical cannabis cards. So I'm obviously not a pharmacist knowing, oh, you should have this formulation or what that looks like. But we do medical cannabis evals. So if they're coming in Utah, it can be hard. You can't necessarily get it covered for insomnia, anxiety.
Or whatever.
Yeah, so I think that's a hurdle we have to kind of cross with Utah. Is it has to be one of the approved reasons, which for most of my patients, if they have chronic pain, that's usually probably the best way to get it approved in Utah.
In what cases do you see that you're like, oh, I think THC would help with this?
A lot of times I think if they're coming in for this specific medical cannabis, they kind of already know. Maybe their friends are like, oh my gosh, I was able to come off Ambien because I can sleep with it. So they're usually already wanting it. But every once in a while, let's say we start with hormones for a female or a male, and it's like, okay, they're sleeping good. We're on some supplements, but they're still not quite sleeping as well as they could. Then I'm like, okay, maybe we try an alternative route and add in some medical cannabis. Or if they do have chronic pain, rather than being on gabapentin for 4 times a day, let's try something else. With the low dose naltrexone, I had a patient. She had all this surgery, all these things. She came and saw me. She was on gabapentin 4 times a day. She felt like crap. We put her on low dose naltrexone, and between that and some other modalities, she's completely off all of her pain medications.
How long does low dose naltrexone take to work?
I think it depends on the patient. I would say typically the dose I'm giving patients is 4.5 milligrams is the full dose. If you're still weaning up, I tell patients give it at least a month of being on the full dose before you call it quits.
She's like, I've been on it for 6 days and I don't feel anything. I'm like, that's because it's only been a week.
It's hard because everyone needs a different dose. So yes, that's the common compounded dose. The beauty of compounding, I can compound any dose. So if you're a patient that maybe needs more than 4.5, we could go a little bit higher than that. If you're half of a tablet in and you're like, oh my gosh, I feel great here and I don't need more, then we could compound a lesser amount.
Because I'm doing 1 right now. Like and then I'll
And
go
that's
up
such
to
a
4.
low dose. Yeah.
Yeah.
This whole concept is crazy. This functional medicine, the fact that I could go to an appointment and you could customize a health plan for me, and if it's not working, we can adjust, and I can come back and follow up and see what's working. I've never had that type of care and treatment before. It's kind of how older people think about therapy, where it's like, oh, why would I go to my primary care doctor? They're not going to do anything. They're going to say everything came back normal.
Yeah. And again, I think they're in a really hard spot because, like I said, my clinical with primary care, smartest guy I know. He knows so much. But I think he's got a big job because everyone's coming to you with every complaint, and like your hands are kind of tied because you're like, your reference range is normal. If I prescribe you thyroid and we go above those levels, that's malpractice essentially.
So they're trying to stay careful in all the things. This might be a hot button topic, but as far as the insurance and trying to make money, do you feel like that plays a role into how these doctors are caring for patients?
I think so. I know a lot of models. I've only done clinicals at certain places, so I don't know how every practice works. But at some of the places I worked at, a lot of them are based on commission schedule, where based on how much money you're bringing in or how many patients you see, you make more commission. So that's where I think a lot of times you have a 10-minute visit because you can see 30 patients instead of 20.
And then you get more money.
Exactly.
Or do you feel like a lot of doctors will get kickbacks for prescribing certain medicines?
That I'm unsure of. I'm not as familiar with that. I know vaccines, those are hard.
Yeah. Okay, let's talk vaccines. I know it's so hot button, but you have kids. You're in the medical world. Vaccines, go.
I know. It's such a hard topic because I'm not anti-vaccines by any means. I think I just saw an article that the first measles case was actually just confirmed in Utah. Like it's kind of making a comeback. There's things like that you should 100% be vaccinated for.
Because people are probably like, I'm not doing any vaccines. And then now they're getting measles.
I do agree with, though, this is where I'm in the middle. I agree with vaccines. Sometimes I think we put too much on young kids at a young time. That for myself, what I do with my kids, how I've done it is I do all their vaccines for the first year. And the reason I do that is because my kids go to daycare. If I was at home with them, I probably would even go slower. But because they're around kids and they're getting sick all the time, they're at a higher risk of getting things. So for me, the daycare makes sense that I'm like, okay, we're doing the first year. So I do that. And then from there, I just slow it down because there's some research out there that shows for chickenpox, if you give it at 1 year old, sometimes they have to have a booster. Still going to give it to him, but I don't want to give him 20 shots at once. That I'm like, okay, maybe I give it to him when he's 3 or 4. So I think there's some research. I just tell patients, I think it's really important to do your own research. And if you have a pediatrician that doesn't resonate with you and is pressuring you into getting all these vaccine and follow the vaccine schedule to a T, I think you should find someone that more resonates with you.
Where can people do research? If I'm a new mom and I'm like, oh, do I believe in vaccines? Do I not? Where do I even start with that?
Yeah. My favorite, I'm not sponsored in any way, but Dr. Green is her name on Instagram. She does probably one of the best jobs. She has a whole vaccine strategy and guide, and she's a doctor. So I really like her perspective because she's a lot like me, where there is a need for certain vaccines, but there's some rotavirus. It's like an oral one we give babies. Do you die from it? No. Do you need it? Probably not. So again, we're giving these 3-month-old, 6-month-old babies so much in their body, which they get all these heavy metals and all these toxins that a lot of times, yes, you can give it to them, but if you're not detoxing and getting it out of their system, maybe they feel like crap. So my theory is whatever you feel good about. I'm never going to tell someone like your theory is wrong. I do think there's a need for vaccines. I just don't necessarily think it needs to be pushed so soon. I think it's okay to spread it out if you want to, if you feel good about that.
What about as an adult, the flu shot, the COVID vaccine? Do you believe that vaccines could genuinely save a life or help?
I think there's a population, if you have all these comorbidities, right? You're really old, you have pneumonia, all these things that, yes, maybe you're at a higher risk of developing that, yeah, maybe it could be beneficial. For myself, I got forced to get the COVID vaccine or else I was going to lose my job. But then they said, just kidding, we can't do that.
Same here. I worked at an ophthalmologist's office and I had to get it.
Yeah. And so I was frustrated because we were just starting IVF and I was like, I'd rather do it really quick right now than do it while I'm pregnant. Mm-hmm. So I did get the first one. But I think what we're seeing, I do something called EBU or ozone on my patients where I'm cleaning people's blood. And we're seeing things like long-term COVID, whether they had the vaccine or they didn't. We're seeing just thicker blood, and it was a very inflammatory disease. So when I'm cleaning out all these toxins from people's blood and seeing thicker blood and people are clotting all the time, we're seeing that from COVID.
From COVID and the vaccine.
Yeah.
So my mom actually died from COVID.
Oh, I'm so
and
sorry.
she wasn't vaccinated. And so this is like a very obviously hot button topic because it's like, I'm like, did COVID even exist? And then I'm like, oh yeah, like my mom. Yeah. But she had some like underlying health issues. And I think like at the time she didn't pass away till like 2021. And so more research had come out on the vaccine and they were actually scheduled to get it when she went into the hospital. But with that being said, and I'm sure you can't like explain that away, but I always like beat myself up about it because I'm like, oh, I should have pushed her to be vaccinated or I should have whatever. But it started with her getting pneumonia and then she got COVID, or I don't know which chicken or the egg came first. But do you feel like would that like, I don't know the science behind vaccines or if that really would have made a difference, but do you feel like when you're in those scenarios, like that they can make as much of an impact to be like life-saving, or if you already have those underlying issues that it's kind of a coin toss?
Yeah, that's hard. I am pretty medical that if they have all these underlying issues, will it help? Maybe. Could it cause some harm later? Maybe. Could you be more inflamed later on? Yes. Yeah, that's a hard one to answer. I feel like though there's the functional medicine in me is also though like, was her hormones balanced? Like, you know, like what did her overall health look like? Like,
yeah,
did
definitely not.
Yeah,
like PCOS, prediabetes.
Yeah. So that's where I'm like, I think we're failing as a system. We're waiting till people get really sick and then we're treating them rather than being like, hi, you feel like crap. Your levels don't look optimal. Let's get you optimal so we can prevent you from even getting to that spot eventually.
But I feel like how the system's set up right now, insurance isn't covering upstream.
No, they are not.
And do you feel like that's just money?
Oh, for sure. Again, like I told you, number one, big pharma medication prescribed Thyroid, levothyroxine. Number one.
What's your response like when we talk about GLP-1s, which we'll get into? Oh, will insurance ever cover those? And everyone's comments is like, oh, America, our health system wants us to stay overweight and unhealthy, right?
Yeah.
Do you feel like facts, or are you like, no, not quite that because you're in the medical system?
Yeah, that's hard. There is a point of me that this Eli Lilly coming after places like us for doing compounded Tirzepatide, Semaglutide, it's about money. They're losing money. They want to be the one doing all of it, right? So they're trying to make it more affordable. It's more about the money. My personal opinion is I don't think it stems from, oh, I want to heal all these people. It's because they want the money is how I see it.
That's what's so crazy is behind the scenes, there are maybe not the truest intentions in traditional medicine.
That's why COVID and the vaccines, that all felt so controversial because everyone was like, why are they pushing these vaccines? Masks don't work. It is very political.
Oh yeah. And I think that caused a lot of mistrust between patients and now the medical system. They don't trust us because they're like, this is what happened with COVID. Why would I trust you?
Yeah, it definitely broke that trust. Okay, so hormones, I'm learning, come back to everything. Okay, where are the hormones? How do you feel about your PCOS patients? Someone walks into your clinic with PCOS. Are you like, oh boy, here we go? Or are you like, we got you, we can fix this? Because as someone who has PCOS, it feels like a moving target.
I love PCOS patients because I feel like there is a lot I can do for PCOS patients. It's not like my derm patient that I'm like, oh crap, what am I going to do with your skin? PCOS, I'm never stressed about. I feel like with PCOS, we've come a long way. I think originally it was like, oh, if you have these symptoms, you have cysts on your ovaries, you have to be overweight, you have to have hair on your chin, you have to have acne. If you don't have all these symptoms, then you don't have PCOS. And I think we've really come a long way that PCOS can look like so many different things. Someone could be struggling with weight, but then I'll have someone come in that is the thinnest person I've ever seen, and they still have PCOS. So I think we've come a long way trying to change that picture. And I can't just assume by looking at someone when they walk in, if they have PCOS, I can usually tell by their symptoms. What we're seeing more of PCOS evolve into is it's a metabolic disorder. We're seeing very, very high estrogen. With estrogen dominance, that is a very high inflammatory state. So these PCOS patients are living in this high inflammation state. Then usually what we see is progesterone is very low. So one of the best things you can do for a PCOS patient is give them bioidentical progesterone, because if your estrogen's up here and your progesterone's down here, you're going to feel like crap. So if we can just bring that progesterone up to give you more balance, a lot of times that can help them feel a lot better. And I would say probably the biggest, best thing we have on the market right now for PCOS is Tirzepatide.
How does GLP-1s, Tirzepatide, Semaglutide, I know there's talk of it helping with a lot of PCOS patients and even autoimmune. It seems like the miracle drug, right? Mm-hmm. So scientifically, what does a GLP-1 do for PCOS?
Yeah. So kind of distinction. We've got two main ones. We've got semaglutide. We've got Tirzepatide. Ozempic is the name brand for semaglutide. Mounjaro, Zepbound, name brand for Tirzepatide. So they're both GLP-1 agonists, which essentially we're just increasing that GLP-1 hormone in the body. So I don't use semaglutide a ton because it's really focusing on when you release that GLP-1 hormone, that's the hormone you release when you eat food. And that's what tells your body you're full. So it's really working on the food noise, the hunger. If you struggle with that, it can be really great. A lot of people feel crappy on it. I would say 80% of patients are really sick on semaglutide. It is cheaper, so sometimes if cost is an issue, that's a lot of reasons why people go semaglutide route. If they come in and they're already on it and they're doing great, I'm not going to change it. But I will say 80% of patients, they'll be like, I was super sick. It wasn't even worth the weight loss. They felt like crap. Tirzepatide is our best friend. So Tirzepatide, it's doing two things. It's not only increasing that GLP-1 hormone that's working on the food noise and the hunger, but it's also targeting something in your body called GIP. And that is targeting your insulin resistance. It's targeting your blood sugar. It's targeting your inflammation. So that is why patients feel good. It is doing two things.
Stabilizing all of that.
Yes.
Like when you say it targets blood sugar and insulin, it stabilizes your blood sugar so it's not up and spiking up.
Yep. I've seen people 3 months on Tirzepatide being in a diabetic to normal and optimal A1C.
Wow.
It's targeting cholesterol. I've seen cholesterol drop 100 points on Tirzepatide before.
And that's even just microdosing. Like people can be on it who are underweight even.
Oh yeah. We have a lot of people microdose it that maybe if they're not necessarily using it for the food noise or the weight loss, you do a super small dose and it's really just helping balance that inflammation in the body, which a lot of times people just feel good. They tell me their brain fog's gone, their joint pain's gone. They can't explain it. They feel good.
So what about with Hashimoto's or autoimmune diseases?
It's the inflammation. So with any autoimmune or Hashimoto's, for example, those TPO antibodies are usually really high. What's usually triggering it is inflammation. So when we bring inflammation down, the antibody production goes down, which then your thyroid starts working better. So it's really targeting the inflammation. So whatever you're struggling with inflammation, whether it's your joint pain, it's your autoimmune, it's your brain fog, people feel good because their inflammation is controlled.
That's great. So I'm currently going through IVF right now, and I've been on a whole journey with fertility and stuff. And inflammation is one of those things that I'm like, do I have inflammation? I don't know. Should I be on an inflammatory diet? Are there supplements or things you'd recommend to lessen inflammation outside of a GLP-1 recommend to your patients?
Oh yeah. I know cost is an issue and a lot of the things I'm doing is not covered by insurance. So I get that can add up. Mm-hmm. Like I was explaining the EBU, essentially that's using ozone to clean and oxygenate your blood outside the body. So a lot of people who struggle with inflammation, whether that's mold exposure, toxins, your endocrine disruptors, long-term COVID, we're filtering all of that out of your blood and just oxygenating it. And then what we do is we run it through UV and LED light, which just has a lot of healing property, and put it back into your body. And so I've seen that heal a lot of people's inflammation. I check inflammation markers before and after, and it significantly decreases their inflammation.
So when I first started my infertility journey, I went and saw what I thought was a functional medicine hormone specialist. And my first visit with her, she basically was like, your labs look pretty normal, but your DHEAS was really high, which basically said was my cortisol. So really the first few months of my fertility journey was you should try this specific type of yoga and really try and lower your cortisol. And I was left with that for a few months, and I actually had it on a period in like 6 months. I had PCOS. I wasn't even officially diagnosed at that point, but I had all the symptoms, the acne, the chin hair, the weight gain, like all of these things. I had gained weight and I had it on a period in 6 months. And so when I go to her, I'm like, a certain type of yoga cannot be getting in the way of my cycle stopping. I was like, this just doesn't make any sense. And from what I learned about DHEAS, it sounded like that kind of controls, like if that's off, it makes your progesterone and estrogen and things go off. A lot of PCOS patients, they struggle with cortisol. And that was something that I really tried to get a grip on for so long of, okay, I'm going to go on morning walks. I'm going to avoid morning coffee. Like, how much does cortisol have an effect? And like, can you explain that DHEAS thing?
Yeah. So if you understand your hormones, they all stem from cholesterol. So that's also, I think, a big thing that some providers miss is they're always like, cholesterol's bad, cholesterol's bad. Yes, but you also want good, healthy fat. So I think a lot of PCOS patients struggle with good fat. So I'm always like, you should be on an omega. You should be on something called C15 or fatty 15. If you're getting all these good essential fats, that's where all of your hormones stem from. So let's say you're a patient, you're not ready to do hormones and you don't want to go that route, then there is a lot of diet changes you can do. Because again, you're in this estrogen dominant state, which is very pro-inflammatory. So then you put on top of that all these endocrine disruptors and all these foods that have all these toxins and all this sugary coffee and all these things that you're just doing daily and putting in is not helping your estrogen dominance. And so there's ways. Cholesterol, DHEA is next. And then that's your downpour of the rest of your hormones. So they're correct in a sense that, yes, it's kind of a precursor to the rest of your hormones. So if that's off, it could be impacting the rest of your hormones. But I wouldn't say it's like the end all tell all. Like I check DHEA sometimes. I wouldn't say it's the best marker for cortisol. If I'm worried about cortisol, the best way to check that is actually through a spit test. Because if you're familiar with cortisol, if we're just doing like a snapshot test of it, your cortisol is fluctuating throughout the day. So we're only getting that little picture. We're not seeing the whole picture. So if patients really think the cortisol is the issue, I have them collect their spit throughout certain times of the day and it will exactly show me what's going on with their cortisol. Because if I checked it at a certain point and it looked great, but then it's spiking at nighttime and I don't know that, we could be completely off on your treatment plan. So I think cortisol does play a role. However, I don't think it's the only aspect. I think there are some things, yes, lifestyle, controlling that can help. But I think there's other ways like your progesterone. It is a very calming hormone that if you're in this high stress inflammatory state, just giving someone bioidentical progesterone can be a game changer for them. And I think a lot of providers sometimes are nervous to throw hormones because yes, there's risk with hormones. However, progesterone is very protective. It's breast cancer protective. It's uterine cancer protective. So that's a hormone I don't lose sleep over. So you can't necessarily overdose on progesterone. So that's kind of my go-to for PCOS. And yes, there's supplements we can take. Inositol is a really great supplement that I put all my PCOS patients on. So I think there's more than just cortisol. I think there's a lot of things you have to look at. But I would think, yes, it is probably helping the situation. But like you said, I don't think it was like yoga is probably going to fix the whole problem. I think there's a lot more that goes into it.
Mm-hmm. So if somebody is listening and they have PCOS and they feel out of control, I'm gaining weight, I'm anxious all the time, like all of the symptoms that you have, what are some things that they can start with that will actually make a difference? Obviously it's case by case scenario. You'd probably need to look at their blood work, but are there things, because you can go down a rabbit hole like, okay, I can't have any candles, I can't use any deodorants or perfumes or all the endocrine disruptors. What things actually make a difference?
Yeah, so if we're looking from lifestyle, we already mentioned decreasing stress wherever you can. Getting sun on your face first thing in the morning, great for your cortisol. Going to bed and not staring at your phone right before bed, great for your cortisol. And I feel like there's lifestyle food changes. So yes, I tell patients actually having coffee first thing in the morning is really great for you. Just most people are going to Starbucks or somewhere where it's like 90% sugar and 10% coffee. So if you can control the type of coffee you're getting, control the sugar content, I think just low sugar, low starch is really great for kind of getting that inflammation down. I think bioidentical progesterone is too overlooked. I think that is huge for most of my PCOS patients. Like I mentioned, the inositol supplement, that is a great option to just really help get your metabolic health in check. Berberine can be a great option. It's almost like a natural form of metformin. It can really help those blood sugar spikes and help control that if that's an issue. And then just managing inflammation wherever you can. Like I said, whether that's ozone therapy, Tirzepatide is probably the best thing we have for inflammation right now. Low dose naltrexone is a great option. So I think just in whatever ways we can support inflammation is going to give them probably the best success.
Mm-hmm. So what about infertility? I know you went through IVF. I don't know if it's just because I'm in the community, but it seems like it's becoming bigger and bigger, right?
Oh, yeah. I think I saw a study the other day. It's like 1 in 7 now have to do IVF. It's a big stat.
It's crazy. Do you know or have any inklings of what's contributing to that?
Oh, I'm sure it's 100% endocrine disruptors. So
Really?
I think it's a lot of just our environment's changing. We have all these toxins on our food quality sucks. And I tell patients, you can't just dwell on that, because then you start to go down this rabbit hole of, I can't do anything. I can't breathe in anything. So you have to be realistic. So I tell my patients, start small. So things that I made super small changes is like, what am I constantly touching daily that I could change that would be an easy change? So for example, I can't control that I'm breathing in microplastic in the air. Sure, you could get this huge, expensive air purifier, all these things, but I'm like, is that realistic for me? Probably not. So for me, I'm putting clothes on every day. So there's things, I get really clean laundry detergent and I get wool dryer balls, dryer sheets, awful for you. Regular laundry detergent, awful for you. So for me, those are simple changes that I was like, okay, I can make this change and I can commit to it. And it's something that I'm putting on my body daily. And I think as females, it's a lot harder because we're putting so much on our bodies. We're doing makeup, we're doing lotion, we're doing perfume, body wash. There's so many things that in the beauty aspect, if we can cut down there, it could be really beneficial. So I really just tell my patients, I try to educate them, what are endocrine disruptors? What do you feel like you could control, and just have a plan? Maybe it's just once a month you're going to start with one thing, and then the next month you're like, okay, I'm going to get non-toxic candles, or whatever that looks like for the patient that they realistically can commit to, so that they don't become overwhelmed and they're like, oh my gosh, I can never step outside of my house again.
Because that's what's hard, especially when you're going through infertility. It's like, manage your stress, don't stress, but also don't eat any of this, don't have any endocrine. So I'm like, okay, so nothing good in life.
Oh yeah. And it's such an emotional part of life too, that you're already struggling. It's that balance of, yes, try to control what you can, but also don't go down that rabbit hole of like, oh my gosh, I can't do anything, that now you're even more stressed and more anxious and more depressed, because that's not helping the situation either.
Were you already in functional medicine when you started IVF?
Not quite yet, because I had my son right when I graduated and P school. And so, no, I was not quite into functional medicine yet.
Is there anything you would have done different on your fertility journey, knowing what you know now?
Oh, for sure. Like I said, there's things like the EBU, cleaning the blood. I've heard stories of people doing that and then they get pregnant and they've never been able to get pregnant. So there's lots of things. I think just controlling inflammation. Obviously, like Tirzepatide wasn't a huge thing at the moment. There's lots of things I maybe could have tried because I struggle. I have pelvic inflammatory disease. And so that's why we have to do IVF. Both fallopian tubes are completely blocked off. So for us, it was automatic IVF, which kind of sucked. But also in a way, I think it's nice. I feel for the people that have unexplained infertility, because I can't imagine how much more frustrating that is to, we have no idea why you can't get pregnant. And for me, it was like, oh, okay, this is why you can't get pregnant. So I feel like there's definitely things like progesterone and the low dose naltrexone. I had one patient reach out to me saying she did IVF 4 times. None of her transfers ever took. Her 5th one or something like that, she took the low dose naltrexone, and it's the only IVF pregnancy that took, because it works on inflammation. So I think there's little tidbits like that. Yes, my IVF transfer, it worked the first time and we're really grateful and lucky. But I do think there's some things from a functional standpoint that I could have been so much more educated on.
What are your thoughts on GLP-1s with trying to get pregnant? I've had friends who've done IVF and then they started Tirzepatide and got pregnant the first month.
Yep. I would say PCOS, trying to get pregnant, probably one of the better things we have out there, because if you're struggling with inflammation, I'll clarify, if you don't have a lot of inflammation, maybe it won't do a lot for you. If you struggle with inflammation, it will probably help a lot.
How can you tell if you have inflammation? Is it a blood test?
Yeah. So in my clinic, like, we do lots of inflammatory markers. So I can physically see in blood work, but also I guess on symptoms, I can tell if someone's struggling with inflammation. But I would say more often than not, there's things like homocysteine, CRP, ESR. There's all these inflammation markers that I have on my panel that I can see if they're elevated or not.
On a blood panel.
Mm-hmm.
I know GLP-1s are a little bit newer, at least with a mass majority of people using them. On research, could you take that while trying to get pregnant? Could you take that while breastfeeding? Or is it one of those things that we don't know enough about that you don't recommend?
We've had the GLP-1 drugs around for probably 15 years or so for type 2 diabetics, right? So maybe there's not as much information on the inflammation aspect. I think it will be really cool to see what that research looks like. So I tell my patients, if they're trying to currently get pregnant, they have PCOS or they've been trying for years, I'm putting them on Tirzepatide to try to work on their inflammation. And I just tell them if they get pregnant or they're gearing up to that and they're trying to conceive, it's in your system for about a month from when you take it. I had someone reach out to me the other day starting IVF, and she's been on it, and she's like, when should I stop? Again, I don't think it's negative for your hormones. I think the biggest thing is, yes, maybe we don't have enough data to see if there is negative consequences on being pregnant. I'm more concerned from a standpoint that you're probably not going to be hungry enough to eat to maintain a pregnancy, because what's helping people get pregnant, I don't necessarily think there's going to be harm to the fetus. But yes, we don't have a ton of information on that. I think from the GLP-1 babies we're seeing, I don't think we've seen a lot of defects or deformations. It's more so from the appetite perspective. You may be nauseous, you may not already be hungry, and then putting that GLP-1 on top of that, you really need to be fueling your body when you're pregnant.
And same thing with breastfeeding.
Breastfeeding, I have a lot of people on it, and I tell them my opinion is if you're breastfeeding and your milk's established, I'd wait probably until then to make sure it doesn't impact your milk supply, because if you're not eating, you're maybe not making as much milk. So if that's a big priority to them, I just have to tell them, are you okay losing your milk if that happens? If they're not, then I'm like, maybe let's wait. It's not necessarily I'm worried about it transferring to the baby.
Yeah, because could it get to the baby and then the baby's appetite goes down?
It potentially could. I personally haven't really looked at that research. My conversation with them is, if you want to do this, we'll do a really low dose, but just know if it impacts your milk, you have to be okay with your milk going away.
Because I think a lot of women at that state, of course, you're postpartum and you're like, get me on this as fast as you can. But I'm breastfeeding, so I can't. And I've heard mixed reviews. Some people are like, oh, you can totally take it. But then I'm like, oh, it's not really something you want to risk, feeding your baby and not knowing. But it's probably personal preference.
Yeah. And that's where I just educate my patient. This is as much as I know. I know I don't know everything, but from what I've seen, I recommend this. And if you're okay to lose your milk, worst case, if that happens, then let's do it. If you're like, oh my gosh, I want to breastfeed for a year and I would be devastated if I lost my milk, then I'm like, maybe it's not worth it to start it yet.
Is there anything, like Sammy is just starting IVF, that you would recommend, like supplement or doing something to kind of help?
Yeah, what are your thoughts on acupuncture? Acupuncture in general, I guess for fertility assistance, but...
Oh, yeah. I believe in this multi-view approach that I don't think it's only hormones. I don't think it's just acupuncture. So I think anything you can do that's just really great for your body is a good thing. Go for it. I even started with the infertility look into foot zoning, which people start to think you're into witch doctors and stuff. I feel like whatever you feel good about, if you believe in that, you feel good about that. I think that's great to have this multi-view approach. There are some things I wish my IVF doctors, them being a specialist, I felt kind of blindsided being like, you checked my blood work, but you didn't do this. So one thing like vitamin D, no one ever checks it. I guess my IVF doctors did. And then now knowing what I know, I went back and looked at my levels. Not optimal. They never said anything about it. Vitamin D is so important for your fertility. And that's the easiest supplement you can take.
Just for it to take?
Just in general, trying to conceive.
So many women are really low in vitamin D.
Oh, and we live in Utah. We have winter for 6 months. And then when it's hot, it's like 1,000 degrees. So we never want to be outside. So we're already not spending enough time in the sun. When I'm consistently checking vitamin D, everyone's at 20 or 30 in Utah, which optimal, closer to 80 to 100.
Yeah, I'm taking vitamin D, so that's good.
I'm glad that they told you that. And then I'd mentioned the inositol because it's really working on your metabolic health, or berberine for blood sugar control.
And it made me so sick.
Really?
I took it and then I felt so queasy and but I keep telling myself, I'm like, just give it another try. Is that a very common thing where it would make you sick?
I don't see it a lot, but I know supplements can be tricky because there's a whole market out there, right? And so I tell patients quality is really important. Where you're buying it's really important. And I think that can be really even hard to navigate for patients because they're expensive. You don't know who to buy from. So yeah, there can be good supplements on Amazon, Costco, but every once in a while I'll check levels. They're on a Costco supplement and their levels aren't changing. So I'm like, okay, you're either not taking it or your quality sucks. So at my clinic, we carry medical grade supplements. The brand I really like is Orthomolecular, and they hold themselves to such high standards. So when they're coming out with stuff, they're doing all this research, all this testing, and you can only get it through a provider. So again, I think it just makes it a little easier for patients because I trust it. I see the levels improve. So that's also where I'm like, okay, maybe it was just not a great quality supplement. Maybe it was. Maybe you just need to change how you're taking it. A lot of times if supplements are hurting and patients are nauseous, it's like, okay, let's try taking it with food or switching the time of day you're taking it. So there's a lot that I think goes into it. But I tell patients, if you're having a symptom, that's really where I'm like, communicate with me because I don't want you to give up. Let's try something and see if it fixes itself.
What about postpartum care? You think, okay, I'm having a baby. It takes me a minute to regulate and get back to normal. Soon can someone after having a baby come see you to start for an accurate level check of where things are going to sit and what needs to be adjusted?
That's a good question. We could go a couple ways with this. So if someone, with my second boy, I really struggled with postpartum anxiety. With my first, nothing. It was a breeze. I was like, how do people complain about this? This was a cakewalk. And then with my second, holy cow, the postpartum anxiety. I would be in a room with my in-laws and be like having a panic attack. And I'd have to like walk out of the room and they'd be like, are you okay? And I was like, I cannot breathe. So I feel like for patients that maybe they're in this really hard state of anxiety, depression, I like to get them in sooner than later. Yes, maybe their levels are going to be off because you're breastfeeding and yes, you're all over the place. But one of the best treatments for that is progesterone. I feel like progesterone can solve so many things. But when you're pregnant, your progesterone's really high. And that's why sometimes women, I don't know about you, I felt pretty good being pregnant. I was never sick. I felt good. A lot of females, if they feel good during pregnancy, it's probably because their progesterone's high. They feel calm, they feel great. But then once you hit postpartum, it drops to nothing. And that drop is what causes that postpartum anxiety and depression. So a simple fix, give them progesterone.
So tell me about the different types of progesterone. Because, okay, so when I saw that first doctor, she gave me these little cubes that you bite like half of. They're like the
like
jelly.
a
Like a troche. Yeah. Is that like a synthetic?
That was probably bioidentical. Because if you're getting it through a compounder, I guess they could change the type. I don't know who would compound a synthetic progesterone. That just seems weird. So I would almost guarantee it was probably bioidentical progesterone.
Okay. So there's that. And then there's progesterone like suppositories or progesterone shots during IVF and infertility. Is that all the same type of progesterone?
More often than not, it is. Again, it could differ based on the provider. Usually when I'm talking synthetic progestins, those are the ones you're usually finding in birth control. Oral birth control pill, the IUD, Nexplanon, all of those are synthetic progestin. So to my understanding, unless they are prescribing that, most of those different forms are all usually bioidentical progesterone.
Okay. And then Chelsey, when she had some pregnancy complications, she had to get progesterone shots to help with like her baby's growth, right? So that's all kind of coming from the same place. Like your progesterone needs to be stable to take a pregnancy and to hold a pregnancy because low progesterone can cause a lot of miscarriages and things, right?
Yep.
So it's all coming from the same place of just your body's not creating enough progesterone.
Yeah. I think this last month.
When I was on those shots, it was like I had such a horrible experience. And then I feel like this like bioidentical progesterone, like I feel like it's different, but are those usually the same, like bioidentical for the shots?
Again, it's hard because I'd have to see what they prescribed. So again, I'm not into the fertility world. I should probably look into it though, because I'm also curious like what my progesterone shots were. But I feel like a lot of times it's a very, very high dose. So sometimes if it's too much, the hard thing with hormones, it's almost like I tell patients it's the Goldilocks hormone. If you don't have any, you're going to feel like crap, but also if you have too much, you're not going to feel good. So usually where patients maybe aren't feeling good, if you're really trying to sustain a pregnancy, it's probably a really high dose of progesterone, which for your body probably doesn't feel great, but for the pregnancy is needed. So I feel like when I'm doing bioidentical progesterone postpartum, it's a really, really low dose and it's a capsule. So maybe the form is different. I'm not as familiar with the difference between the shots and the troches. From my understanding, they're the same, but I wouldn't be surprised if it was just a way higher dose.
Okay, that makes sense.
Which hormone makes you so emotional? Like right before your period, is that a drop of estrogen or
progesterone? Well, kind of both. So what they both do, the first 2 weeks of your cycle, they're low. Estrogen usually peaks first, and then right after that, then progesterone. And then around day 19 to 21 is usually when progesterone is highest. And then what happens is if you get pregnant, then that continues to increase. If you don't get pregnant, that drop of progesterone. That's why the 2 weeks before your period, that's where PMS happens. Because you're up here and you're all calm and you're feeling great, and then you lose it all. So that's where females, it's usually that last week or 2 weeks. They're irritable, they're cranky, they don't want to have sex, whatever it may be. They have their acne flare-ups. It's just, again, they're losing their hormones, and it's just a dramatic drop. That's where the beautiful PMS happens.
How long do you have to be on the progesterone to start seeing a difference?
Asking for a friend.
Not me.
Depends on the patient. It depends on what symptom relief they're looking for. If they're having a really hard time sleeping, that's almost immediate. Within the first night or two, they're usually sleeping through the night. They're not waking up. It turns off that brain noise so that they're not thinking about 20 things, and they just can really go to sleep. I have an Aura ring, and tracking sleep on progesterone versus not on progesterone, I get in a deeper, better quality REM sleep. But let's say you're using it for anxiety. There could be lots of factors playing into your anxiety. So that could maybe be improving, but if it's not optimal, or if there's other things triggering the anxiety, it could be helping, but maybe you're not quite where you want to be. So maybe we have to focus on your gut health and other things too, because maybe you're not absorbing it. So there's a lot that goes into it. I would say symptom relief, I tell my patients at least a month on it. But if it's not working, then I'm starting to be like, okay, why is it not working? Is your gut health off?
Else.
Yes, exactly.
What are your goals with your career? Are you going to someday open your own practice, or do you like being a part of a different practice? What do you see for your future?
Yeah, I feel like ultimately I saw myself doing my own thing, but I first started at 2 startups, and now I'm at a very established place. Running a business is hard. It's a lot of work. You're working when you're not working. And I was like, okay, maybe that's not what I want to do. But I think it's just because I have really little kids. And I'm already having that mom guilt. And I don't think I'm in a season of life right now where that's my goal. I think right now I just need stability and I need consistency. So I'm okay with that.
You want to just show up and do your work.
Yeah, because sometimes it's nice to clock out and I don't have to deal with all that other stuff. But I think ultimately maybe when my kids are older, maybe when I'm an empty nester, we're talking 10, 20 years, maybe I do my own thing. Who knows? Maybe I go a completely different route. It's just very exciting because as I go to conferences every year, there's always new things. So I'm like, who knows? Maybe I jump from hormones to something else, or maybe I'm adding more to my toolbox. But I think the specialty will be the same if I work for someone. If I don't, I think that's up in the air for now, though. I'm just really happy where I'm at.
Do you feel like social media has been and can be a tool for what you're trying to do?
I think ultimately my goal for social media is just to be a place people can turn to for education, that they're like, oh my gosh, I've never heard of this before. Like I was saying with that low dose naltrexone, I probably have messages on the daily about it. And they're like, my doctor won't prescribe this. What's a common dose? So being a place that people can be like, oh my gosh, I can refer to this is ultimately my goal. Like, yes, if I get a client from that, great. But I think my best clientele is just word of mouth. If a patient feels good, they're going to refer their friends. So I don't feel like I actually need social media to be like, come see me. If my patients feel good, they're going to tell all their family and friends about it.
Especially addressing these things that just feel so helpless.
Mm-hmm. For sure. Those 3 to 4 month follow-ups from when I first see a patient are the most rewarding. I'll cry with my patients. I'll hug them. Just watching them transform and just being like, you saved my life, you saved my marriage, whatever that may be, that ultimately keeps me going. And the late nights missing my kids, I'm like, okay, that's so worth it, because I truly feel like I am helping people feel better and just being in a better spot.
Well, we're so happy that you came on. Like Chelsey said, we could talk to you for hours. We both have so many questions still, I'm sure. Is there anything that we didn't address or talk about that you're wanting to touch on or mention or anything?
No, I don't think so. I just think it's cool that you guys are getting into this and obviously spreading the word. And it's just cool that you guys said you haven't been doing it for a long time, and it sounds like you guys are already pretty successful. So that's cool.
Yeah, it's been really fun. It's been really fun.
Yes.
Well, thank you so much for coming on.
Yeah, of course. Thanks for having me.
We'll talk to you guys next week.
Love you. Bye.
Bye.